Hello, I'm Dr. Chris Steele. Now, managing chronic pain is a daily battle for joint pain sufferers, with many relying on painkillers such as paracetamol. I'm here today to speak to Tony Mayo. In 2007, aged 62, Tony was diagnosed with acute osteoarthritis of the hip. Well, thanks Tony for talking to us today. So tell me about your condition and your story.
I remember the onset of this problem very, very vividly. All of a sudden I got this tremendous pain in my right hip. My leg froze solid and I could scarcely walk. It felt, I suppose, in hindsight, like I'd been shot, like I'd lost my leg. Obviously, as soon as I could, I went to my GP. Yes, it was acute osteoarthritis of the right hip, and to a lesser extent the lower back. So obviously, I asked if I could have a hip operation. And he said, "You're too young at 62, so no, you've got to manage with what you've got, I'm afraid."
Where did he go from there?
He prescribed painkillers, which I took, but it didn't seem to do much for me, except it gave me some side effects which were not pleasant. I did a certain amount of research and I came across an article which suggested that a compound called Goppo could offer long-term relief from joint pain and reduce the need for other painkillers. And after 5 weeks, I suddenly thought, hey, I think I could get up the stairs of that bus and get down again. Yes, I could. So that was marvellous.
Did you have any side effects?
No, none whatsoever.
Are you still taking rosehip?
Yes, I still take 4 tablets a day. I credit rosehip with Goppo for restoring my life.
Many people with joint pain are recommended glucosamine. However, the NICE guidance for osteoarthritis state that the use of glucosamine is not recommended for the treatment of osteoarthritis based on comprehensive review of the evidence. The Joint Pain Forum suggests that those who have been taking paracetamol for a prolonged period should be considering alternatives for the long-term management of their joint pain. They suggest there are supplements backed by clinical evidence that could have a key role to play in the long-term management of joint pain without the risk of potentially harmful side effects. Hopefully, hearing about Tony's experience will be useful if you too suffer from long-term joint pain. Now remember, ongoing joint pain is not something that you should just put up with. Unfortunately, there is no one-size-fits-all remedy for joint pain. There are many pain relief options available, and effectiveness can vary from case to case. The challenge is finding the one that best suits you and helps you to manage your pain efficiently and safely. So here's a recap of points worth remembering when considering a treatment or supplement to help manage joint pain. If you consider taking a supplement, it is backed by sufficient evidence and reliable clinical studies to prove that it works effectively for long-term joint health. 2. Safe for long-term use. While some treatments are safe to use for short periods of time or intermittently, some may cause side effects if used for long periods of time. It's important to check.